Hello students, now we will see about epidemiology. In epidemiology we will see aims, uses and tools. So first we will see the meaning of epidemiology. The epidemiology is the term derived from Greek words. It is originated from Greek word. Epi means upon, demos means people and logos means study. So we are going to study the people. So what happened to the people related to health? So that is the meaning of epidemiology. Epi means upon, demos means the people and logos means studies. So related to the health issues and health events we are going to study upon the people. Coming to aims of epidemiology. So what is our aims in epidemiology means, first one is describe the distribution and magnitude of health and disease problem in human population. So how much the health and health related problem are distributed and how much the health and disease problems are present among the human. That is our first aim. Then second aim is identify etiological factor in the pathogenesis of disease. So if any disease is present means what is the risk factors, what are all the causes of the disease, that we will see in the. Then third aim is provide the data essential to the planning and implementation and evaluation of services. Mainly we are providing the data for planning some services, health related services. So there are three aims. First is to describe how much the disease and health problems present among the people, and second is find out the causative or risk factors, and third is provide all those data for planning and implementing the services for the people. So this is the three aims of epidemiology. Then next we will see about uses of epidemiology. So there are mainly two uses over there. Under that also we will see the description. And first one is uses related to health status and health services. What is the uses related to health status and health services? And next, what are all the uses related to disease etiology? So uses related to health status and health services. So health status may first to study the history of the health status. We can study the health history. So from what is the beginning, what are all the reasons. So first thing we can study the history, and second diagnose the health status. We can diagnose, and third is to study the working of health services. So we can study how much the services are providing the care to the people and how much the services are present and whether it is sufficient or what the services are we are giving. So that is only the uses related to health status and health services. We can study the history and we can diagnose the history, the health, and we can know the. Then second is uses related to disease etiology. So what are all the uses related to disease causes, disease etiology? First one is estimate the individual risk and chances. We can find out the risk factors of individual who are all prone to get those diseases. And second is identify syndromes. We can identify the syndromes and we can identify the chronic disease and we can search for the cases of health and disease. So this is about the uses related to disease etiology. Next we will see about tools of measurement. So there are three tools are present. First one is rates, ratios and proportions. This is very important. Rates, ratio and proportion. Rates, ratios Next we will see about first one is rates. So we will see through the example. Death rate equal to number of death in 1 year divided by mid-year population into 1000. This is example for rates. Like this there are many rates are there. So here we will see about the death rate. So here denominator is there and numerator is there and one multiplier is there. So we will see which one is denominator and numerator and multiplier. So death rate is divided by one line. So the top line which is called numerator and the bottom line called denominator, and into 1000 is called multiplier. So here we are having one numerator, denominator and multiplier. So we will see the explain number of death in 1 year. So example you take AIDS. So in throughout the 2019 how many persons are died due to AIDS? So that is death rate, and divided by mid-year population. Mid-year population means they will calculate the population mid-year. Every year they used to calculate the population, how many total populations are present. Example mid-year means middle of the year, July month is there. So month of July they will calculate the population. So that is called mid-year population. July, month of July, how many total populations are there into 1000. So they will calculate by this way. So this is called death rate. So a rate measures the incidence of some particular event in a given population during a given time period. So it will measure the incidence of some particular event or disease in a given population. Given population means
maybe in India during a given time period. During a given time period means I already have told you 2019. Then coming to next point, the rate expressed per 1000 or 10,000 or 1 lakh. So already we have seen in death rate we have seen the multiplier we cast 1000. So here we can have 1000, 10,000 or 1 lakh. Then characteristics of rate, in that numerator will be present, denominator will be present, and time specification also will be there, and multiplier. Then various categories of rates, or so there are two categories there: Croods rates and specific rates. So what is meant by Croods? Croods means whole we cannot specify anything. Example, I told you in death rate may only due to AIDS how many persons are died, but coming to crude rates, so we cannot tell only by the AIDS, due to AIDS the person death occurs. So we cannot tell only the specific thing. Croods means whole, so we can take death due to any kind of reason. So maybe AIDS hoga or any disease hoga or any chronic or acute disease, anything, heart attack. So that is all together. So we cannot specify one disease. So everything. So that is called a crude rates. Specific rates means already I told you death rate. Death rate may only due to AIDS how many persons were died. So that is called a crude rate and specific rates. Coming to proportions, so it indicates the magnitude of a part in relation to the whole. So we can see the equation of proportion. Proportion is equal to A divided by A plus B. So here A is numerator and A plus B is denominator. So numerator and denominator. So example you take A may be the under 5 child affected by malnutrition in Kosamba. So you can take example of Kosamba. In Kosamba mein malnourished children are there in under 5 children. So that is A, and divided by A plus B. A plus B is the whole population. Whole population means mainly the under 5 children in Kosamba, the total under 5 children. So here coming to the total under 5 children in Kosamba, it includes malnourished children also. So that is called a denominator. Here we can see how many proportions are present. So how many of them are diseased in a whole population. So we can find out in according to this formula. So this is about the proportion. So example, I told malnourished children, which will be we have taken in the numerator is a, and that is malnourished children, and divided by a plus b may the whole under 5 children. Whole under 5 children means in whole under 5 children, which includes malnourished children also. So this is the person included in the numerator or always included in the denominator. So this is about the proportions. We can find out how many of them are affected in the total population. So this is about the proportions. So proportion in epidemiology tells us a fraction of the population affected. How many people are affected in the total population. So already I told the example in Kosamba, under 5 children's total population may how many children are affected with malnourished. So this is about the proportion. This is expressed in percentage. Always we used to express in percentage. So how many maybe 20% of under 5 children are affected with malnourishment, like that we can tell it in a percentage. So already we have seen the numerator, and then coming to the ratio. So we will see what is ratio, like a proportion. So if it is a fraction but without a specified relationship between the numerator and denominator. So there is no relationship between the numerator and denominator. Example, in proportion we have seen numerator will have a deceased case like malnourishment, and under that the same people under 5 children only will come. So under 5 children of total year will be there, but here so female and male, so there is no relationship between the numerator and denominator. There under 5 children with malnourishment and divided by total malnourishment children. Total under 5 children are there. So that is about the proportion. But here in ratio there is no relationship between numerator and denominator. It includes two random quantities. Two random quantities means different quantity. Example, female cases and male cases. There are different cases, and ratio is the result of dividing one quantity by the another. So example is occurrence of hypertension. So female cases may be 240 cases female are affected by hypertension, and males are affected by hypertension 120 cases. So the ratio is 250 female cases divided by male cases. So 240 divided by 120 equal to 2:1. So female to male ratio, so female is more than the male. So 2:1. So this is about the ratio. For more reference, you can refer Parquet textbook of Preventive and Social Medicine and Shamla D. Manivanan textbook of Community Health Nursing. Thank you.